Dr. Betsy, and we're here with another episode of Body, Mind, Spirit. We're going to be talking today with Cho Lin Moy, and I'm so excited to be having you here, Cho. Cho, I don't think I've ever said your whole name all once, so I apologize, but I'm very excited to be talking to you.
Thank you for having me.
So, how did you get into women's health and Chinese medicine?
So 2 parts, right? So Chinese medicine, it was really, I had, a whole other life before getting into Chinese medicine. I worked in business, corporate, and it was really this event, evolving over time that, led me to, go to school and learn about it, right? I came from a very Western medical background. My father was one of the first Chinese Western trained doctors, right? So he went to medical school in the 50s, in the 1950s. And so very, we might call that the golden age, I guess polio vaccine and surgery and all that stuff. So very Western, but it didn't really interest me, the same way, because it always felt very transactional and, people lying in bed and, surgery. So, I went a different direction. And, but my interest in health was always there. It always felt like there's something more. And it was really, the corporate life that you suddenly see you're just like a hamster on a wheel. And then you're like, wait a second, you got to wake up a little bit. And I can't see this the rest of my life. I want to do something that's important and help people. But also, you have to help yourself, your passion, right? Otherwise, you just burn out. And, so then I went to massage school because I always, I love that and the body. And when I was there, studying Eastern foundations, more questions. Well, wait, what does that mean? What is that? And it's so vast. It became very apparent that I just needed to continue and study. And, after 20 years, because now I'm practicing 20 years, I still study. I'm still researching. I'm still excited to learn. And, every patient that comes to see me, you learn something, right? They're new, and then you apply the principles, right? Not the protocols, but the principles. Now with women, working with, more women's health, most women are, I would say my practice is probably 97% female. And women are the ones that are always searching for, natural methods or different methods. They're searching for their family. They're like the doctor moms. They're always, looking for that. And so my practice really started with women coming because they wanted to get pregnant. And, in Chinese medicine, you look at a woman's menstrual cycle is a good indication of their overall health, right? So that's how it started. And you become expert based on who seeks your help, right? Because then you go deeper and deeper and you get more experience and better success for them. They, having a baby is I consider that successful for them, so that's how it happened.
So we were talking a little bit before. I had a interest at one point in reproductive endocrinology, which are those fertility doctors, and it just, I don't know, my road went down a different way. But it's really, I think women go through this period of their life where they're at first like trying not to get pregnant, and they think it's just such an easy thing to get pregnant, and then all of a sudden they're like, okay, now I'm ready to get pregnant, and they think it's going to happen like right away. And it really always amazes me the number of things that have to line up for a pregnancy to actually occur. And that can become very stressful for women. that where it's not working, and it's not working the first time, the fifth time, the 100th billionth time, So from a Eastern standpoint and Chinese medicine standpoint, how does that differ when you're dealing with someone who's having difficulty getting pregnant? How does it differ from like what we traditionally see here in the United States in Western medicine?
So in the Western medical model, it really like treats, they're looking at the symptom. Oh, that, there's this or you have that. And they're looking, let's say, at a lot of things like very like your hormones, or they're looking at structurally, kind of like addressing it almost like a car. We're going to check your oil, we're going to check your carburetor, are the wheels aligned, but not necessarily, who's been driving that car and abusing it, right? So this is the difference is really like looking at all aspects of a person's life. We're looking at, the stress levels, looking at the history. Oftentimes, there might have been some kind of a, accident or trauma. A lot of women are just systematically put onto birth control as teenagers. And so you see that if there were any, problems that might have been there, things that are, and also things like eating disorders. You'll see like eating disorders, underlying, health conditions, like maybe they had a lot of infections before, that those things are all going to impact. And if they're and also digestion, right? So, like their microbiome, all of those things are contributing to their reproductive health, right? So not looking reproductive health and then everything else. It's like it's all one thing. And so, you know, a woman can come with, let's say, the same, let's say, difficulty, but you would treat her differently, right? Because there's an age factor, there's a genetic predisposition. You kind of look at like all of those things. Endocrine, as you know, like thyroid, they can have a lot of inflammation in their body. So diet is a big aspect of it, right? That's gonna affect. So the approach, is really whole health. We're looking at all of it, and definitely the stress. Like there's a big. What I find mostly the women that come to see me, extremely successful, right? They're very driven. I'd have to say 80% of those ladies are Ivy League graduates, like higher graduate level degrees. And so they're really smart, and they're accustomed to like getting like, this is how you do it. And when they don't have success, they're following exactly everything. That creates so much stress, like they're running on adrenaline fumes. And it's really a matter of like looking at, what do you need to do? I need to get pregnant. Okay, actually what you need to do is to get your body into that state where it will receive, right? Not get, but receive. And so that would be the difference of like, and everyone, is different. Like sometimes meditation doesn't really work for somebody. A lot of times they don't. They're so, high strung. So I would all say, okay, try something else, like a moving meditation. Something that you can move your energy gently, but also you don't, feel like it makes you crazy.
But
So
what's a moving meditation?
moving meditate, yoga is moving meditation, Tai Chi is moving meditation, different kinds of stretching, where what it is that mind body connection. So you're focusing on your breathing and the movement at the same time. So oftentimes sports require you to coordinate your physical and the breathing, and also the focus, right? You're just like immersed in it, and that helps uh, to strengthen the mind body connection, which then you're able to calm your nervous system down, right? Or even like breath work practices help to do that. You can reduce the cortisol levels. Yeah. So they're different for everybody, like,
Yeah,
but
and that's so tough. Like you're saying that especially that population of individuals, because like they work so hard to get what they want, and this is something that the body is just like, all right, like you can work hard and stress yourself out, but it's not going to get you anywhere, because really those stress hormones have such an effect on the fertility hormones that the more you stress about getting pregnant, the less likely you're going to get pregnant. I think this is why a lot of times you'll see families where they've tried, and all of a sudden they like give up, and then they adopt a baby. And then now they're like, okay, we adopt a baby. And then all of a sudden they get pregnant because they've now kind of like let go of that stress of trying to get pregnant.
yeah. Well, there is also an aspect of, I mean, I also work, with my patients, we work in more of a program format, so that it's really offering them activities and some exercises to help guide them, right? Because the last thing I want them to do is start like searching on the internet, getting stuck in these, rabbit holes of despair, right? And last hope. It's like Dante's Inferno. So something like a manifestation, right? Like imagining you already have it, right? So you're there. So you're past that hump of, oh, will it ever happen, to actually being able to see yourself actually having it, like with a vision board, and really like, what would it be like, so that you can actually move away from the it's not working into the possibility. And yes, the relaxation of like, okay, now I don't have to worry about that, when I think about having a child. But also there's an aspect of, you have the baby, right? So I think there's like two parts of it, right? That there's that kind of manifestation, like that it's there, and so really to see yourself and experience. So yeah, having a baby really helps to move that energy, right? And to really then make the focus of like, this is really what we want.
Yeah. And, I don't want to, this might be too complicated of a question to ask right now, but we can get into it some more later. But, and how's the role of acupuncture play in fertility?
Okay, so acupuncture plays an extremely important role. That acupuncture will actually elicit the release of neuropeptides into the central nervous system, which trigger rest and digest. So to really get out of that fight or flight sympathetic mode, which is not conducive to reproduction. It actually, has it's stress. Your body needs to go through that curve of cycling down, like the rest state. It's akin to, you have the yin and the yang, right? The daylight and the evening, and your body needs to be kind of synchronized, and the biorhythms, the circadian rhythm is really important for all of your hormones, the melatonin release, the sex hormone, like all of those are interconnected. So that happens, so your body really experiences a chemical shift in inflammation, like reducing inflammation. The next is that we're improving the circulation and blood flow to the abdomen. We're helping to clear the lymph and metabolic waste that can also build up in our system from the pollutants, the water, the food, all kinds of, like, all of those other things that as our body is functioning, that can build up. So we need to like have the organism working optimally. So those are just some of the things. And then of course it's personalized to the individual. And so that also makes a difference as well, right?
That is great. I can't wait to find out more. We're going to talk to Cho Lin Moy after we come back from the break.
80% of women will develop a pelvic health condition at some point in their lives. There is relief. There is hope. The Pelvic Floor Store, your resource for personal health.
We are back with Tsao Lin Moy, talking all things fertility and Chinese medicine. So I didn't mean to rush you through acupuncture, because I'm sure that was, there's a lot more things that we need to know about acupuncture. But you know what? Even though I've talked about acupuncture in the past, I've never really asked somebody this, because I kind of assumed people know, but for someone who's never experienced acupuncture, I've brought it up to patients before and they're like, whoa, I don't want to have needles stuck in me. Like, can you explain like what the actual process is, and like how does it feel to have acupuncture performed on you?
Okay. So, in an acupuncture session, someone's going to come in, we'll get their whole health history, and also family history is really important, right? And then also like looking, at what's going on for them. And so I do a palpation, I check, I take their pulse. I mean, I might look at their tongue,
I've heard that with the Chinese medicine, and because that's something in traditional medicine, we don't ever look at people's tongues unless you're like an ear, nose, throat doctor, or unless someone's complaining about their tongue. But I know in Chinese medicine they look at the tongue a lot.
Yeah. Okay. So the tongue is actually, as you know, it's actually a muscle, right? So it's really an easy place to take a look at, like, hey, what is actually going on in the body, right? So somebody who, and as a physician, someone who they stick out their tongue, and if their tongue is kind of purpley, they might have some kind of congestive heart failure, right?
Yeah.
Or so there are different there on the tongue, there's actually a mapping of the body. It's like a little, similar, it's like reflexology in the ear or on the hand, or there are all different parts of the body which are these micro maps and microcosms of the person's body, which is, if somebody has, like, for instance, is missing a limb, right? Like if they had an amputation or something, that they can have what they call phantom limb, right? Because energetically there's something that's, that's still there, right? And so we could address treating the actual phantom limb through these other mappings, right? And reflexes. So really, like, looking at the tongue, for instance, for women, when I look at their tongue, I can tell, like, maybe they are a little more anemic, right? There are different parts, like under the tongue. I'd look and see, are the, the veins maybe bulging or blue or something, which may tell me that they've got some blood stagnation, or things to actually guide me into, like, hey, I think I want to look at this and check against the symptoms and your complaint and like what you're describing, and to see if that is is that showing up in terms of a pattern, right? So there, and we also look at the coding. In the West, everyone, like, brushes their teeth, scrapes their tongue, and most of the tongue diagnosis, it's very ancient. It's like really like thousands of years old, or to really diagnose. And really, when people are very sick, and as a physician, when you go through training and you're in the hospital, you see people like at the worst cases, right? And you will see it, like their tongues may have the yeast or the candida. You'll look and you might see that it might be peeled, right? Like different areas, like a geographical tongue, or or if they have like a high fever, there are different, you can actually see, and someone who has experienced, let's say, chemotherapy, you will actually see on their tongue that they might have like a deep crack in their tongue, and especially in the back, where it'll show that that they have undergone like a very serious, let's say, illness, or a physical trauma. Like, for instance, the body has undergone something really very strong. or even life-threatening, right? So those are indications that are kind of saying like what's going on in the body, right? So we're kind of like looking at a muscle and, you know, what's there. The throat, the mouth and the throat are the gateway for viruses and other things. So you get like a little peek into, you know, what's happening inside. So I mean, I know you look in other areas on the inside. That's not in my scope of practice, right? But similarly, you know, it is mucous membrane, and you're looking at, you know, what's going on. So that's one way of kind of like what's the general, you know, big picture general health. Also looking at the complexion. You know, you can see like, do they have lividity? Do they have their chi or their life force? Is it shining through, or like dark circles, or, you know, or is they're looking peaked or anemic, or, you know, like, and so there are colors and things and different areas of the face that you kind of look at. You take okay, this person looks like they're, you know, blood deficient, or they, you know, there's some nutrient that needs to be done. Okay. So maybe that means we have to address their digestion. So they absorb nutrients and then it'll show up, you know, shows up other areas. So this is like overall, like their skin, you know, fingernails, their hair, right? We know people who have nutritional problems will have, you know, their hair will, you know, they're different things. So really like big look at the overall health. And then, you know, palpating different points and reflexes then will indicate what to treat, like what to, you know, what points are going to be helpful, right, with confirmation. And so palpating those points, are they sore, are they not sore, is also, you know, helps diagnostically for the choice. And then really then using the needle, we clean it with alcohol. We use clean needle technique, disposable, you know, pre-sterilized disposable needles, one use only. And, you know, we tap the needle into the point. Now, what someone might feel is a little pinch, right? These needles are extremely fine. They'll feel a little pinch. They may feel a little pressure, achy sensation. And this is as the body is like saying, hey, what is this needle? And that starts to, and really very quickly inserting, they're not going to feel pain, right? They'll feel a sensation, but not pain, because most of the sensation you're going to feel is at the surface, like the skin surface. So you bypass the surface pretty quickly. And then the nervous system will feel like, what is that? And then it generates, you know, a message back, you know, back to the brain, but also, you know, locally, there's a lot of body intelligence, right, going on. And so then, you know, you have a response locally to then mobilize the body system to be like, hey, what's happening? You know, I would say alert, more like bring awareness. And again, the mind body connection is like, oh, I'm feeling something. And, you know, patients actually feel the chi moving around their body, which is pretty, you know, it's pretty exciting. So they're like, hey, I didn't know my body could do that. Yeah. So it's not really pain. It isn't painful. I mean, of course, sometimes they can feel like a sharp feeling, but the needles are different than hypodermics.
I know. I was gonna say, tell you that I've gotten it done, and it's definitely not like giving blood or getting labs drawn. It's, you know, there's sometimes I've had it where you don't even feel it at all when the needles go in. So, and, you know, it's always, it amazes me. So when I've run into people that are kind of resistant to the idea of acupuncture, and they don't necessarily believe in it, I'm like, well, do you believe in an EKG? You know, like we see like EKG, we put these pads on the body and it picks up the flow of energy in the body, and we put it onto a piece of paper and we can see it and read what the heart is doing. I'm like, if we can do that, like there are these meridians and these energy flows in the body. So a lot of times people are like, oh, wait a minute, you're right.
They're totally energetic flows. And really what I look at the meridians a couple of different ways. One, they are biomaps, right? So in the Chinese medicine, or this is like ancient creation embryology, they look at the first meridians are the ones that separate, the first the embryo, or the cells they separate, which say like what is the top and the bottom, that are going to tell like this is going to be your top part of your body, this is going to be the bottom part of the body, this is going to be the front part, this is going to be the back part, these are going to be the arms and the legs, right? So there is something that directs, where things are going to start to develop. And then, growing, then from there, from the navel, it's like all grows out like a flower, kind of it telling those cells, right, to become something, right? So there's some kind of information that says to those undifferentiated cells to become differentiated, and to divide and become your arm, your finger, your eyeballs, all of that, right? And so those are those biomaps, and those are the meridians, right? And there are ones that are known, like that are part of the original, like this is what told your body to do it. And so they I consider are like the back door, like of a program. So once you're born, something else takes over, but those maps are still there. And so when your body is out of balance, they're there to just kind of like tap in and send a reminder like, hey, this is like to like cycle through, right? And so that's it, in what I think of them as like, what are they exactly? That they continue to kind of like send the energy signals for the rest of the system. And on another note, with the, Chinese New Year is coming up, right? With the zodiac, there's also an aspect of, cosmology, right? And that, we can map the universe, but also we've got maps too, like how did we arrive, and what also influences us, right? So our star charts, that's a whole other discipline in Chinese medicine, astrology, and more esoteric aspects. But we can actually look at that, like certain zodiacs may have more of a propensity for certain health issues and temperament, and then looking at, reflecting the elements also, onto their health.
This is so fascinating. And do you incorporate herbs also into when you're dealing with your patients?
Yes, I do, if it's appropriate. So I'm much more conservative with it, because sometimes my patients come and I go, oh, I need to see, oh, what else are you taking? And they're taking so many supplements, so many medications, and I'm not going to add some other thing on top of that. It's really going to be, okay, I'm going to look and see what we can work with while you're doing that. And then let's look at maybe taking some of that off, right? So if they can be compliant with it, and also herbs are not the same as supplements, right? Because you're looking at supporting the body getting better. So as they get better, you're gonna shift maybe what they're taking and what they're doing, so that they're not on them for life, right? It's not the same as, oh, you need to, the idea around it is really to help them cultivate their health. And food. So if you can heal your system, like your stomach and your gut, you're going to absorb your food a lot better. So you don't have to keep on taking tons of supplements that are supplementing the, where you're not able to do that, right?
Yeah, you should be getting it from your food, not necessarily supplements all the time.
Right. Now, the one thing that I have to say though is that, you know, our food is really lacking in nutrition,
Yeah.
right? And so that's something that we need to look at. So on that, you know, on that note, I like, okay, we have to take that into consideration, that one, our digestion, it doesn't work so well, and number two, that our food sources are usually lacking in nutrition. So we need to kind of overlap that.
If there was one thing that you wanted people to try to do more of, what would that thing be?
Um, I would have people be much more conscious about what they're, you know, what they're doing, and to really do a little bit of research. Uh, Big thing, I would say, sleep. Like really focus, because that's going to help to reset their immune system, their hormone levels, right, their mood, and that'll help them be more in alignment, you know, with the earth and our environment, right? That's going to make a difference.
Where can people find out more about you?
Oh my goodness. Okay. So I'm on Instagram. I also have a website, which is www.integrativehealingarts.com. They can visit me there. Probably Instagram, if they want to contact me, it's probably easy to find me on Integrative Healing Arts, MYC. And
Great.
yeah.
Thank you so much for being with us. Remember, check Cho out on social media and her website. While you're there, take a look at our website at WYTV7.org. And don't forget to hit that donate button, because every dollar that you send us will help bring great programs like this one today. And also, more importantly, help support our community events. So make sure you check those out and tune in again next week to Body, Mind, Spirit. Thank you so much, Cho.
Thank you.